Okay, so welcome everyone to the School of Health Sciences DHA Project Informational Session. I'm Dr. Lori Shandison, the Dean for the School of Health Sciences, and I am joined this evening by Dr. Whitney Jones, the Assistant Dean for the School of Health Sciences, who will be co-facilitating, and Dr. Robert Clegg, Lead Faculty for the Health Administration Programs, who will also be co-presenting this evening. Now, we've created this session for you all, for students, because we know that some of you are drawing closer to the time when you're going to have to prepare your project prospectus. And you may have some questions because you want to get started early. You may want to know what makes a good project, what can and what can't I do. And we want to make sure that if you do want to get a jump started, you do want to begin to think about what it is you'll do for your project, that you understand what you can and what you can't do, what makes for a feasible project and what is just too unwieldy. So we're going to go over a few things this evening. This session is going to be recorded, so if you would like to refer to it again in the future, you'll have access to be able to do so. We're going to show some slides, and if you'd like to get a copy of those slides, we'll send it along with the link to the presentation. So I'm going to ask that you all stay on mute until the Q&A time, and there'll be a time where we'll ask you to participate and talk to us about some of the ideas you have. We'll also spend some time explaining how you can schedule a one-on-one session if you want to develop your idea and get some advice on how to do that with any of us, all of us. It's up to you. We just wanted to be able to provide you with this opportunity to start to think about what it is you ultimately would like to do for your project. So without further ado, I am going to start the slideshow. All right, can you see my screen, everybody? Yep, I see heads nodding. All right. So I did introductions already. And the first thing we'll talk about is what a project is and what a project isn't. If you're in the DHA program, you know that or maybe you don't know, so let me rephrase that. There is not a dissertation that you will be completing to earn your degree. Instead, what you'll be doing is developing a project that can be applied. So you'll be working on an applied project. The scope of that project needs to narrowly fit into what it is that you hope to study without overthinking this, I guess. What I'd say is that you want to work on something smaller that can be applied in the future. We'll get into some examples and go over some of the things that you're thinking about initially, but the main thing that you should understand is that this is not a dissertation. It doesn't mean that it won't be written with chapters. It doesn't mean that this won't be a product that you can use as a writing sample in the future, or one that does not incite additional investigation. It absolutely can be used in the future to be applied, to be implemented, depending on what it is that you'd like to do. But the scope of this needs to be pretty narrow. And our job is to help you focus narrowly and then apply this project to whatever it is you're working on in the future. We'll get into a bit more of that in a minute, but right now we're going to look at some of the definitions. Dr. Jones?
Thank you so much, and thank you all for joining us. So I want to start out and just make you familiar with some of the terms that you're going to hear from throughout your program, specifically when you get into DHA 7008, again in DHA 7013, and then as you move into your project courses. Those courses are called the Applied Doctoral Experience, or ADE. So that's 4 courses, and I'll talk about those in a little bit more detail in just a minute, but it's the culminating accomplishment of your degree program, and it is the process of completing your doctoral project. So, okay. So those of you that have finished DHA 7008 have already submitted your premise, but I wanted to just briefly describe for those that may be on the call that haven't reached 7008 yet, or maybe are right there right now. The premise is the deliverable in DHA 7008, and it's a very brief document outlining your idea for your project. It can be considered like a developmental tool, and it's similar to a concept paper. It helps you narrow your topic down, and it provides a general sense of direction for your project. And it is not binding, because you may have an idea in 7008. By the time you get to 7013, your idea may have been changed based on additional courses. So that's okay. It's not binding. There's other things that are in that, but moving on to the prospectus. This is one of 2 deliverables that you will produce in DHA 7013. The prospectus is just a little bit more involved than the premise. It is going to be a well-organized document that clearly outlines your proposed project. It serves as a foundational plan and agreement between you and your chair of your committee, and will guide your project proposal. So it includes your problem statement, your purpose statement, your project significance, your background, types and sources of information and data, proposed outline, timeline, and any challenges or barriers that you anticipate. So those are the things, and it's not a long document, but those are the things that your prospectus will address, and it's what gets approved to move you forward into your ADE courses. The next term is portfolio. This is the second deliverable in DHA 7013. This is a well-organized professional collection of relevant documents or artifacts that demonstrates your knowledge and your skills as a health administrator. So you want to be thinking about some of these assignments that you've been doing throughout the program, and you will pull those forward and create a professional portfolio that you can share as you may be looking to further your career. The proposal, lots of P words here. The proposal is sections 1 and 2 of your project. So it is just that. It is the expanded version of the prospectus. It is a very detailed document of what your project is about, why you need to do this project, and how you're going to do it. So it gets into the methods and the methodology, and how you're going to collect what you're going to collect and do what you're going to do. This is submitted before you actually collect your data. So I want to stress that there's no collecting data until you've been through an IRB process, and I'll talk about that in just a little bit later.
Dr. Jones, if a student if the student says, oh, I'm watching this video right now and there are all these things that I have to do, I'm not going to remember, what would you tell them would be a resource to help them find this information in the future?
In the future, this is all going to be, a lot of it will be housed in the Applied Doctoral Center, which is connected through the Center for Teaching and Learning through the Commons, and they will have a center that has all of the information that you need. We also have a guide to guide you to create your premise in 7008. We have a handbook to guide you to do your prospectus, and your courses, your ADE courses, guide you to do your proposal and all aspects of your project. And you will work very closely with your chair, and that would be your other resource. Or you can always contact me, and I will put you in touch with where you need to be. I'm happy to do that. Another word, manuscript. This is the final product. So at a dissertation, it's called a manuscript. The end of it, it's all put together, it's a manuscript. Well, this is a manuscript. This is a 3-section manuscript that talks about the foundation of your project, how you're going to do your project, and then the last chapter is going to be what you did and how you did it and how you evaluate that. All right, so the next one are sections, and I've already mentioned that. So your proposal and your manuscript are made up of sections 1, 2, and 3. So to make a difference, a dissertation has 5 chapters, and your manuscript will have 3 sections. That's a differentiation. At the end of your last ADE course, part of what you'll be expected to do is a professional presentation and a defense of your project. This is outlined. We have handbooks, we have templates to help you do this, but so it's not anything to worry about at this point. Your committee, you will hear that, it's made up of 3 individuals: your committee chair, your subject matter expert or SME, and your AR or your academic reader. So your chair will be your faculty member in DHA 7013 and will continue with you throughout your entire project. They serve as your mentor and your consultant on your project, and this is the person that you will work with mostly. Your subject matter expert is just that, either in topic or your methods, or both. They will review your submitted work and provide feedback to help make your project and your final manuscript the very best quality that it can be. And the academic reader reviews the proposal and the manuscript to make sure that it follows academic rigor and NCU guidelines for projects and manuscripts. So I mentioned the Applied Doctoral Center earlier. That's where all the resources to help you successfully complete your project and get through your courses, that's where all those resources will be housed. LibGuides, how-tos, if I need more help with this. So that's where those will all be. And then the last one is the doctoral record. This is where you actually submit. You will submit things within your courses, but your course will also take you to what is called the doctoral record, and that's where you will submit your sections for your chair, your subject matter expert, and the AR to review. That's where they actually score it on the rubrics. And the rubrics will be available in the Applied Doctoral Center for you and in the courses, so that you know what to expect and how to complete your deliverables appropriately. All right, project courses, here we go. First course, now you'll see that this is, it is DIS, which would refer to dissertation. This is a technical issue, so don't let that throw you off. So it'll be the ADE DIS 9911 A through D. So the first A course, of all 4 courses, let me explain this part first. Of all 4 courses, you have a B, C, and D course. The A course is a 12-week course. If you do not accomplish what you need to accomplish in your A course, you move to an 8-week B course. Don't accomplish it there, you move to your C course, which is an 8-week course. If you don't get it done there, then you move to a D course. After that, that's that.
Dr. Jones, what do you mean that's that? If
you don't get it done by the end of D, then it's possible dismissal from the program at that point. There's extenuating circumstances, but you have 4 chances. And if you think about it, that's 2, 4, 6, that's 9 months to get one section of your project completed. So you have lots of time, and we're going to make sure that you stay on target. That's our job. All right, so the first course is the Applied Doctoral Introduction, and this is section 1. It is the foundation And I'm not going to go into all the things that are a part of that, but that you create section 1, which is the foundation of supporting your project. The next course is 9912, and it is the Applied Doctoral Proposal is the name of the course. You will complete 2 things in this course. Your deliverable will be a completed section 2, methodology and design, and a completion of the actual applied doctoral proposal, which is, like I mentioned earlier, is sections 1 and 2 combined.
Dr. Jones, what if I can't get everything done in section A of DIS 9912?
Then you move to section B, and then you move to section C, and then you move to section D.
So each of these project courses allows for 4 opportunities for me to get it right?
Absolutely.
Oh.
9 months. 9 months? 9, yeah, 6, 7, 8, 9. Yeah, 9 months. All right, so 9913 is, this is the Institutional Review Board, IRB, and data collection. You will get introduced to the IRB early in your first course. This is, you have to have approval from the IRB before you collect your data. So please don't start collecting your data now, because you will not be able to use it. We just want to make that very clear. We want to protect you from that. A lot of healthcare projects will be an expedited review because you'll be using secondary data, say pulling some quality data from the place you work, and it won't involve actually dealing with humans. You will have to complete a humans rights and protection training in these courses, just so that we protect humans. That's not to say that you won't be using human data, but I think a lot of our projects will not use human data.
I'd also like to add in here, students, that the IRB that you obtain through North Central University does not mean that you won't have to fill out an IRB from wherever you're obtaining your data. So
Absolutely.
just keep in mind, and you'll learn much more about that and the nuances and the details of how to consider that. But in 9913, you'll be working on the IRB, as Dr. Jones stated.
That's right. And we, as your chair, your subject matter experts, and administration and leaders of the School of Health Science will help you however we can throughout this whole process. All right. So in 9914, you're in the home stretch. You got 4 chances to finish up section 3, which is, and again, this course, you have 2 deliverables. The first one is your section 3, which is your findings, your recommendations, and implications to practice in the profession. And the second deliverable is a completed manuscript. So that's sections 1, 2, and 3 all combined. And then you do a professional presentation and defense where you meet with your committee, you present your project, you talk about it, you allow the committee to ask questions, and then that would be the end of that course.
Thank you.
You're welcome. Thank you for letting me share that.
I know what's wrong with my computer here. Thank you, Dr. Jones, for that very elaborate description that I'm sure many will go back and just review and learn more about those different sections, in addition to being able to have that information supplemented with the documents that you stated would be available to the students. The handbooks, the dissertation, applied dissertation project area, just all the different resources that we'll have, so that students can have something in their hand to actually.
I didn't mention, we also, as a school, we have a proposal template, proposal and manuscript template that has, it's APA formatted, and it just, I know, which makes everybody happy, and has comments to help you know what you need to be addressing. And so we have a template for you so that you would just add to the template, delete the extra comments, and just keep adding to it. So we're trying to make it an easier process for
APA
you.
formatted?
It's APA formatted.
It's Christmas.
Oh,
Hallelujah.
mostly APA formatted. As scholar practitioners, we should always check our APA formatting.
All right, well, I want to now spend some time talking about how you can refine the scope of your project. So there are some of you that feel like you know what you want to do already. And what I'd say is that's great. We've looked at a few titles of some prospectuses, some prospecti, I should say, and they're very broad. The titles are broad, and that's okay because it really, well, it's you're going to continue to refine. So, oh, sorry, I was distracted a minute. You're going to continue to refine, but I want to talk about how you can start to think about this, and you want to think about something very specific. So the first thing you want to do as you go through this process on what is it that I'd like to study is to select a general topic area first. So think about what it is you're interested in. Now, I've heard many people say, if you're going to be working on your doctoral project product, you want to pick something that you're going to love. What I'm going to tell you is it doesn't matter because you're going to be sick of it by the time you're done with it anyway. So if you want to start off loving it, have at it, but you're going to just be fit to be tied. And I'm not saying you're not going to enjoy it because one thing you should do is really try to enjoy the process of this project as much as possible. Don't look at it like it's this big arduous task. Look at it like, wow, this is going to give me an opportunity to demonstrate the skills that I have for doctoral study and advanced. And I'm really going to try to learn from this exercise. Engage with it on that level. And not like it's, oh my God, I have to do this, it's going to be terrible. No, so you know what, I can't wait to do this. I'm going to get the opportunity to do what I want to do, study what I want to study, look at an area that I feel requires more attention. And if you have a good attitude about it, it will facilitate your ability to complete it. So again, select a general topic area first. And then you want to develop your project question. So if you're looking at, you know, a general topic area may be diabetes. And you know how broad that is. There are so many different places we can go with the topic of diabetes. Are we talking about diet? Are we talking about treatment? Are we talking about treatment with people with comorbidities? Are we talking about treatments in the hospital? Are we talking about home care, life care, death rates, associated risks? I mean, we can go on and on and on. You can pick anything. You see how broad the overall topic is. But we want to know, what are you specifically interested in? So I may say, I want to look at diabetes in an elderly community when they have a comorbidity of blah, 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 and they're in a nursing home that's in a rural versus an urban area to see if they are receiving the certain types of medications they need for better health outcomes. Now that sounds a bit long, but I wanted you to see the path that you have to follow, because you'll have an area that you want to look at. You'll know what it is you want to look at specifically, but then you have to make a connection as to why. Why is it important for me to look at this? What do I want to look at this? What am I trying to figure out as a result of my inquiry? And we will help you refine that, refine that, refine that. But I just want you to know it starts off with a larger scope and it gets into a smaller focus. And as Dr. Jones would tell me to remind you all, it must have a health administration focus. So while there are some things that have to do with community health and public health, you are in a health administration program, and we expect that your project will be health administrative or healthcare management related. Another area you can explore is looking at existing literature as a source of ideas. So my area is diabetes. Not really, I'm just giving you this example because I don't know much about diabetes, believe it or not. But if my area were diabetes, and I'm like, you know what, this topic, I really want to do something that's related to diabetes. I get the diabetes journal every month and I start to thumb through it to see what's going on, what's being done. Oh, wow, this is a great study. I wonder how this study could be applied to this population given these other types of circumstances. this study that I'm reading describes it as applied to this population, but maybe in my community that suffers from blah, 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 I can now apply or add on to the body of knowledge as it relates to this topic that I've read about, and now can apply or implement in my own community that has different nuances. So what I get from this project is the ability to look at my topic in another way, and that also advances the research in this area. Anything that's been done in this area now as a result of my project, I can explore that a bit further. So using existing literature, things that you read, things that are interesting to you as a source for your ideas is perfectly acceptable. And you'll also find if you do that, there'll also be a lot of seminal information that you can draw upon that's already presented in that one study. So there'll be information that provides a foundation, a logic, a bunch of different things to help guide your project. Dr. Jones?
I wanted to also throw in there that whereas if you were doing a traditional dissertation, you really rely heavily on the scholarly literature and the peer-reviewed resources and those things. And not that you don't use that to inform this, you are taking current knowledge in the field and applying it to your topic area. But also what makes this so different from a traditional dissertation is that the information that is available within the profession, within like professional organizations, within the professional domain is perfectly acceptable to use in this situation, because that's the people that are, there at the front line using it. So that is another distinction that I just wanted to share.
Thank you. And the next area, another way to focus is to use other studies, as I mentioned, as sources of ideas. So if in fact you do find a journal with an article that was interesting to you, just go back and look at the references and look at the information that was used to inform that article and see if any of those titles resonate with you as things that you would like to further explore. So there's a bunch of different ways for you to get excited and learn more about a topic. And this also helps you build up the foundation for the project that you are going to engage in. So many different ways for you to figure this out. You don't have to sit there stuck trying to rely on your own creativity. It's all out there already. And it will be so good for you to get excited because you're reading more and you're learning more about it. It will truly make you an expert in that area and an expert in the project that you hope to design. What is wrong with this thing? All right. What you're going to do now when you have your project is to put it into a realistic scope. So if I say, I just want to study diabetes and I want to study diabetes in rural areas versus urban areas, that's not realistic. There are rural areas and urban areas all over the United States. And I haven't allowed myself enough of a narrow focus that I can implement a project successfully, given that huge of a scope. So you really want to focus and you want to say that whatever it is that you're going to do is to just really refine, make it nice and tight with the hope that someone can then take your project and implement it or apply it in another setting. So I want you to think that way. Your goal is not to save the world. Your goal is to add to the body of knowledge by virtue of this project. So you want to make sure that it's realistic. And again, what you'll do is work with any of the faculty in the School of Health Sciences that avail themselves to you. Again, we'll talk about that in a second. And you want to say, hey, Dr. Clegg, here's what I'm looking at, all of these different, this area, and what do you think? And he may say, you know what, that is a really great and interesting and timely topic. However, you're going too broad. And he'll start to ask you additional questions, and you'll start to see, oh my goodness, I can't cover all of that. I can't think about all of that. So you want to get really narrow. Working with ideas, maybe at your current place of employment, maybe as it relates to something you've done in the past or something that you're very interested in, are going to be good places for you to generate ideas. Again, you don't have to sit there and try to grab something out of the air and make something up. there's so much going on right now. We want you to focus on health administration, healthcare management, and really narrow in what it is you'd like to do. You want to develop a logic, scientific hypothesis. So the way that you heard me talk about, here's diabetes, then here's the community, then here's the population, then here's maybe a characteristic of that population. It needs to have a logical flow so that you know what you're looking at, why you're looking at it, and you can defend it, and it makes sense as it relates to the scope of your project, what it is that you're trying to achieve. You want to estimate your time requirements. If you've chosen a project that requires that you use annual data that comes out in December, and you're starting your project, in January, you might want to reconsider that. You want to be aware of any time constraints as it relates to your project, which is why using secondary data that's in the public domain, you have the Kaiser Family Foundation, the CDC, there are a lot of great places that have data sets if there's something that you're particularly looking at. But you want to make sure that time and approvals are at a minimum, because you don't want those things to hold you up. You want to be able to have access to the data that you need in a very timely way, using the most robust data you can. Now listen, it doesn't mean that sometimes, depending on the study, you're not looking at data that's been published a while ago. So if you were looking at the Healthy People Initiative, they had Healthy People 2000, Healthy People 2010, Healthy People 2020, and they're about to release Healthy People 2030. These are all aims for the future. It's not to say you couldn't look back on that data and draw some analyses based on what has already existed, depending on your question. And I hope that's clear. And if it's not, don't worry, because when you work with one of us, we'll be able to help you narrow and talk to you about your data set and if it's in fact appropriate. I would say this is so important, is to make sure you schedule your work, knowing that there may need to be flexibility built in. And what I'll tell you is, and how I want all of the faculty who are working on you with this to remember, is that they too had been in this process and they experienced all of the challenges that you were. Families, work, all these different things. And when you've scheduled your day, you said, from Sunday, I'm gonna get up at 8, I'm gonna work until noon, and guess what happens? Sunday comes and somebody gets sick, or somebody gets a flat tire, or somebody needs homework done, or there are a host of things that could take you off target. And so what I'll say is, build in the opportunity for some contingency planning. What you can do is try to get a little done every day versus saving it for these big chunks of time that you feel like will be uninterrupted, that eventually get interrupted. I use the strategy of working in the wee hours of the morning. I would just wake up 2, 3 o'clock in the morning because I couldn't sleep anyway, of the stress of getting my dissertation done. For you, it'll be a project. But the world was quiet. There were no text messages, my phone wasn't ringing, no one was needing me for anything because everyone was sleeping, and I really got to focus, and that was a really good time for me. Throughout the day, I felt so much better because I'd been productive and I wasn't interrupted, and it really minimizes the ability for anyone to interrupt you. If that doesn't work for you, another strategy you can do is what I call the egg timer strategy. I took myself to one of those fancy cookware stores and I bought this beautiful rooster egg timer. And the suggestion that someone gave me was to set it for 45 minutes, put it down. And in that 45 minutes, I had to do everything that was related to my work. So you might want to organize resources, organize references, set up your reference page. It doesn't matter. Look at articles, review, write an annotated bibliography, but you can't check your phone. You can't get up to use the facilities. You can't do anything for those 45 minutes. When it goes off, you have a 15-minute break, take care of things, respond to text messages, and then try to get another session in. It doesn't sound like a lot of time, but if you can get 2 of those sessions in on the days that you plan to work on it, you will see how efficient and effective you can be. Because every time I said, I'm gonna, when I get home on Friday from work, I'm gonna take this, didn't have the energy, didn't have the focus, tried to do it in 2 long stretches. So this is a tactic, a strategy that when it was introduced to me, I totally rejected it. And I just said, you know what, I might as well try it, it can't hurt, and it was really effective. So if it sounds a little odd to you, just set the timer on your phone. Like, just try it. Try different things that you've never done before to help motivate you to get this done. If you stay on a good trajectory to get it completed, you will. The scheduling of the courses is also going to help push you along and keep you on track. And your faculty members, we will all make sure that we knock on the door if we see that you've been missing for a while. So just be prepared for that. And you know what, just very quickly, Dr. Jones, Dr. Clegg, do you have any strategies that you can share that help you complete?
I did somewhat the same thing. I worked at a hospital anyway. And what was really nice is the medical librarian at our hospital gave me the key to the library. And I would go in the wee hours just like you. And I worked on my dissertation at that library. It was nobody there to bother me, no disruptions whatsoever, and I was able to really focus. Of course, I acknowledged her in my dissertation for that, because I don't think I would be able to get it done if it weren't for her giving me the key to the library.
Thank you. Dr. Jones, anything you'd like to share?
I was under a different circumstance where I was only working part-time at the time, so I treated working on my dissertation as my full-time job. So I sat down and focused on it. But I did make sure that I took breaks, and I made sure that I scheduled my time appropriately so that I still had time for family things and things that were important to me besides finishing the project at hand. So those are important things to do.
Thank you. And
Can
you
I just
mentioned, go ahead.
Oh, one thing also, please, everybody, back up your work. I had a nightmare. I had everything saved on a flash drive, and I had just dumped my entire dissertation into the, ours was not Turnitin, but it was another plagiarism checker. Went home, put my flash drive back in my computer because I forgot something, and the flash drive was corrupted. So thank God I was able to go to that Safe Assign report, and was able to download my entire dissertation, although the formatting was all messed up. If it weren't for that, I would have lost everything. After that, I had 3 flash drives, I had an external hard drive, and I had it saved on my desktop.
I always email the copy, and I put the date and the time. I always email it.
I did that too, and I started emailing myself a copy. So when you're done working, email it to yourself, because I wanted to cry, really. I think I did, but I admit it now.
Big boys don't cry. Thank you. Again, don't forget the process of the IRB and the timing of the IRB, and understand the functions and the importance of the project prospectus. Again, you'll have access to all of this documentation. We ask that you read it with a fine-tooth comb. You can't read anything with a fine-tooth comb, but you get the idea. You look at it as the tool to help guide your efforts. Don't try to wing it. We are giving you resources that we put a lot of work into to make sure that you had tools to help you. So rely on those tools. And make sure that you're familiar with the elements of the deliverable. Again, once you're at these stages, read everything. Make sure you understand the different sections, what you're going to have to do. That will absolutely make your work that much easier. Instead of trying to tackle it as it comes up, take some time to familiarize yourself with the entire process and what you're going to be required to do. Review the literature, relevant and appropriate. Have a relevant and appropriate grounding in the literature. So if I'm going to discuss diabetes, it's not because I just pulled it out of the air. I'm going to learn about the disease. I'm going to learn about how it's relevant based on my project and what it is I want to do. So if I'm looking at diabetes treatments for people who travel, I know that sounds crazy, but if you're traveling and now you have a different doctor, I don't know, a host of other things we could talk about there, but I am very familiar with the literature on my specific area. I know who said what, I know who the prominent thought leaders are, I know which organization is promoting most of the research on this area, I know where I can go to find supplemental research. You really want to be an expert in your niche category there. Dr. Clegg, expectations for students, please.
Thank you, Dr. Sanderson. Okay, so first and foremost, it's really important that you, and we sort of alluded to this already, but it's important that you select a topic that you want to research, that you want to. There's nothing worse than writing a research paper in a course that you're really on a topic that you're not even interested in doing. You're just doing it to check box. Well, in this case, this is going to be your lifeblood of your doctoral journey here at NCU. So it's really important that you select a topic that truly interests you. And for those of you who have been in 7008, I've emphasized that. And the ideas that I come across, obviously there's a passion in the topic that you have selected. So keep that in mind as you begin your research. The next thing, of course, is to keep in mind the ABCs. As you know, you've had me for your first course, as well as other courses. And as you know, I read every word of every sentence of every paragraph of every paper, and I comment on everything. There is a method to my madness, okay? So remembering the basics of punctuation, grammar, spelling, content development, and yes, APA style. So it's always really important to keep in mind your reader because you are presenting this as part of your doctoral experience. You're going to have DHA after your name. So it's really important that at this point, when you're working on your applied project, you should have all of the basics down. We should not have to be doing any sort of solid grammar check, punctuation check, spelling check. We're really concerned about the content and making sure that you put together a project that could be implemented in the area in which you've decided to target.
Dr. Clegg, can I just make a quick comment here? Students,
Absolutely.
what I say is when you're putting together these first initial drafts, consider them as being your final work. So don't say, well, I'm not going to check the spelling or grammar or punctuation. I'll do that later. Do it early on and be diligent about checking. If the person who's reading your work can't get through it because they're confusing sentences or issues with punctuation, it makes it harder to review. So use Grammarly, use spell checker, use grammar check, use everything, every tool available to you to make sure that everything that you submit, even though it may need some work, is still in the best possible way you can get it at that time.
Thank you, Dr. Shanderson. The next item is, and this sort of alludes to the previous bullet, is the work that you submit must reflect that of a doctoral level student. Okay, as we know, baccalaureate level writing is very different than master's level writing. Doctoral level writing is a whole new ballgame. Okay, you're actually playing at Wrigley Field here. So your writing should be reflective of that. You should have the synthesis down pat of the literature that you're obtaining and you're reviewing. The content that you're developing should be solid and concise and precise. So if I come in there and I don't know anything about your topic, I should have somewhat of an idea of what you're talking about. I may not understand everything, but if I read your work, I should have somewhat of understanding of what you're trying to say because of the caliber of writing that you're delivering. Exhibit independence and creativity where appropriate. So remember, you're selecting a topic that you are interested in. Okay, so what's really different about the ADE experience as compared to your didactic courses that you've already taken is much of the work is very independent. Okay, yeah, you get 12 weeks to complete that first part, then of course you may move into BC or D series within the first course, but don't let that independence fool you. It's really, really, really easy for you to become complacent when you get to that level because you think to yourself, I got 12 weeks to complete section 1. It goes by very, very quickly. So while you're exhibiting that sense of independence, also remember that you need to set yourself on a time schedule. And at the same time, remember that this is your project. So be creative. Yeah, you're going to write it in third person and it's going to be objectively written, but be creative in this because this is going to be your life work of this project. As Dr. Shanderson said, this is going to be probably your final major project that you complete unless you get into a line of work that you're writing projects and so forth. Be very conscientious and responsive to your committee member suggestions. The big thing here, folks, do not take their feedback personally. Okay, they're not there just to hammer you. They're not there to be, writing heathens. They're really there to help you. So if your content is somewhat shaky, or maybe the synthesis, or maybe the literature that you're using is very, very dated, take their feedback seriously, but don't take it personally. Okay, they're there to help you. Of course, as always, there's a reason why you do an IRB. So always maintain a sense of ethics in the writing. Not only, of course, citing your sources, because if you plagiarize, you're being unethical. Okay, right? At the same time, if you're using data, make sure that you credit that data source. Make sure that if you're using data that may have some identifying information in there, make sure that it's scrubbed first. But of course, that will be captured hopefully in the IRB process. But when you're gauging communities, larger community, it's really important that you maintain that sense of ethics, because it's your reputation is on the line here. You never want to be known as an unethical writer. We've all heard of the Lancet study, right? Dr. Wakefield, well, formerly Dr. Wakefield, when he wrote the article in Lancet about autism and antibiotics, vaccinations being the cause of autism. That article was retracted, which is a rare thing in such a high caliber article. But also he lost his license indefinitely because he lied in his data. That's one thing you can never, ever get back. So you always want to be known as an ethical writer. It's really important. And then, of course, stay in constant communication with your chair. It's really important to close that communication loop. If just like in your regular courses, if you can't submit your assignment on time on a Sunday, you contact your instructor, right? And say, hey, something's going on. I got to submit on Monday. As long as you let us know in advance. The same thing applies when you get your ADE. If something's going on in your life, let us know. Don't assume that we know what's going on in your life. So please always stay in communication with your chair. Thank you, Dr. Sanderson.
Thank you kindly. We are running tight. We didn't anticipate that this would take so long, but I'm glad we did. And we're going to have more sessions where we can actually have you toss around your ideas and we can give you feedback on them. I'll actually try to schedule one maybe for next week or maybe the week after, just to kind of keep you all in the momentum. So take this week, think about some topics. Next week, we'll have another session where we'll allow you to bring your topics to the table and we can refine them together in a group. So to schedule one-to-one appointments, what you can do is send an email to SHS, School of Health Sciences at ncu.edu. And in the subject line, you want to put DHA appointment. And if you do that, we'll know what it's for. And we can then correspond with you to work on a time and a date that might be good to have this discussion with you. If you would like to wait until we have the next session next week or the week after, that would be fine too. If you want to meet sooner, that's fine. But if you'd like to wait, you can. And on the next call, we'll allow you to toss out some topics and say, this is what I'm looking at. How can we narrow? We also invite you to do that in a one-to-one interaction with myself or Dr. Jones or Dr. Clegg. All right, so again, that's SHS, School of Health Sciences, just SHS, at ncu.edu, and in the subject line, DHA appointment. And you can just say, hey, I'd like to have an appointment, and then we'll start back and forth with which of us, if you have a preference. And you don't know our areas of expertise, but you've worked with us, maybe not me so much, but if you have an affinity and you just know that Dr. Clegg kicked your butt in your courses and you just kind of want to hear what he has to say, then, by all means, say, you know what, I'd like to meet with Dr. Jones, I'd like to meet with Dr. Clegg, and we'll be able to get that set up for you. And that session is going to be called Topic Tackle. And again, we would have liked to do that, but we don't. Oh, we're going on until 6:30? I didn't know that. All right, well, we do have some more time then. I'm sitting here about to get you all off the phone because I'm thinking the call is an hour, but we'll be able to talk about some of them. So you know what, why don't we start with a couple? Is there a student on the line who would like to share their topic or something that they're interested in studying? Chrissy Flake, you are on mute. So your second line, I don't know which one is her second line. Is it the?
How about now? I'm trying every which way to turn. One way or another, I will talk.
We hear you now.
Awesome.
Awesome. I'm looking at telehealth as my general topic.
Okay.
And my proposal is to view telehealth as a means to improve healthcare equity and PCP access between Mason County, Washington and King County, Washington. The information behind it is Mason County is 45 minutes as the crow flies to Seattle. And the difference between PCPs is King County, where Seattle sits, has the second best PCP to patient ratio, and 45 miles away, it is the second worst in the state.
So what
And I found it really, sorry, go ahead.
what you're looking at, Christy, is less about the telemedicine than the difference in the provision of care when the PCP ratio is higher. You're using the telemedicine as a way to look at that, but your overall project is about looking at the PCP ratio. You were saying that the ratio was lower in one area versus another area. And you're using the telemedicine as a way to measure that, but that's your overall gist.
I was looking at it as a means to improve healthcare equity. So maybe I'm off somewhere where I think I need to be going.
We can focus on it, but you want to look at you want to look at equity. You were saying, right?
Yes.
So are you saying that there's not equity in telehealth practices, or are you saying when there's a higher physician ratio, there's better care than those who might have to use telehealth? Like, I'm not clear based on what you described.
My thought, and I'm really open to
No, go on.
channeling here.
This is how you do it. This
Yeah.
is how you do it.
My thought was the iron triangle says, you know, part of it is we have to have quality of care. But if I can't get access to care because there are not sufficient providers in my region, and usually PCPs we look at as the gatekeepers or our front line, we don't, you know, theoretically, we don't want everybody just running off to specialists. But if I can't even get to a PCP because there are over 4,000 patients per PCP in my county, but 45 miles away, it's 800 patients per PCP, that I can use telemedicine as a means of improving that access, which therefore improves equity, and modeling it on the state of Wyoming, who has huge issues with access and geographic proximities, as a model of, if we use theirs, could we not apply it here and have similar improved results for access?
So I would like to think, if you're thinking that's the case, then that has already been established. Because if you're looking at, you know, you've mentioned a few things that you want to look at here. You've mentioned the number of PCPs, then you mentioned telehealth as a means to determine quality and some disparities. And if I don't live near a physician, how can I? So we have to make a tighter connection as to what it is you want to look at exactly, and why, and what's going to be the actual measurement. Like, what are you going to use to make that determination? Because if you're already saying these people need, in this population, in this targeted area, need to have telemedicine because there are no PCPs, that's pretty much established, right? So if you're trying to compare the experience of the telehealth to those that have more access to PCPs, you know, we just have to fine tune where you're going with this, and drawing an outline and asking yourself at each point in the outline, so what, so what, so what, so what, will help you get closer to what it is you actually want to look at.
Okay. I will take that feedback and see if I can't do some narrowing here.
Again, it'll listen, this is like a big hunk of clay that we're gonna continue to mold and chip away at until it's a tightly sculpted bust of Abraham Lincoln. I don't know what, Dr. Jones, go ahead.
Okay, so I want to share my experience. Though it was not a project, it was a dissertation. I had in my mind what I wanted to do. I was going to replicate a study that had already been done to see if we had made any progress. And as I was going down this path, my chair was like, no, here you're missing the point. Now in a dissertation you're finding the gaps, what is not there, not what is there, and using it. And that's what I was trying to do, was take what was there and use it. And my chair, and the way I describe it, she found another path for me to go down. She kind of pointed out something and said, let's consider going down this track. And I was like, huh? Because it totally threw me off. But it wasn't that I wasn't on the same track. Somebody just kind of threw the lever and I kind of went a different direction, but I was still on the track. Do you see what I'm saying? So part of our job is to, as you're chugging down the track, we may throw a lever and say, okay, you're still on the track, you're still got speed, but we're going to go this direction instead of that direction. And it's making those connections. And so I think that's important to know, is because you can feel like, oh, I had all this planned out, and then it's like, but what about this? And somebody sees it with a different lens, and as you are open to that feedback, then you really find that sweet spot. And I found a real sweet spot. So I think you all can too.
And of course, Chrissy, I had you for 7008, so I was sort of personally, connected to your project. So I kind of have an idea of what you want to talk about. And Dr. Jones, you kind of alluded to it, where you're taking something that exists and see if you can, copy, replicate it in a way. So I know, Chrissy, you were talking about in your project the possibility of taking that model that's occurring in Wyoming, because they have some of the same demographics and patient mix and so forth that you have, and taking that telehealth, telemedicine model and seeing if you can somehow implement that or adopt that within your area to improve that quality of care, improve that access, and so forth. So yeah, we can flesh that out. But yeah, I remember what you were talking.
I'm sorry, Dr. But Chrissy, if you know that already, right? If you know that this project was being used for this purpose to do, you don't have to recreate that theoretical framework. You're saying, I want to see if this project that was created for this purpose and blah, blah, blah is applicable in this area. So you don't have to try to recreate the whole notion behind it. It's already been established for you.
Okay.
You're saying
I got that
model applicable here, right? They've already worked out why and the rationale, and you're going to adopt that because you believe in it. They've already substantiated it. You don't have to redo that again. What you're saying is, this model that has been established and implemented that has shown this, will it show the same thing when applied in this community? Easy breezy.
Got it. Thank you.
Another thing I would say to the rest of you who may be on the call or who may be watching this video later is, when you get suggestions and you thought about this and you feel like you're in a good spot, don't stay committed to it. Don't own it. Keep an open mind, knowing that you're going to refine. Try not to stay so connected to it that you can't break away from it, or you can't have some distance or look at it differently. This really is your project to demonstrate your skill set. And while we definitely want you to have the autonomy to choose your area, it will need some work. They all do. All of ours did. From now until the end of time, they will. So your attitude is going to help facilitate the progress that you can make on this, and also help you with your level of frustration.
The same thing applies when don't be so personally attached to a project in the very beginning that there's no flexibility. My dissertation chair actually made a great analogy. She said, it's like a house that you've lived in all your life. It was handed down to you, and now you want to sell it. And you think that it's worth this much because you're using that personal connection to that house, and you feel that it's worth $1 million when really it's worth 200,000. So don't, overestimate the personal connectedness to your project. So that you're not as flexible as you can be, because I was the same way. Because I was a patient safety officer, I said, I'm going to do this, this, and this, and this. And I was so rigid in the very beginning, but my chair and my committee sort of talked me off the ladder and said, well, let's focus in this area as well. And so it sort of made me think outside of my rigid box to help me to actually expand my study. And in the end, I was actually much more proud of it than I would have been if I would have just stuck to that initial idea.
So
Thank you very much for the feedback, everyone.
Absolutely, and we're going to continue to refine. Is there anyone else on the call that would like to just talk about their topic very briefly? And don't feel you have to, because many of you may have come on the call with no idea, but just trying to get some information. If you take some time to think about it this week, and at the next session that we have, you say, you know what, I'm thinking about this area. This is intriguing to me, and I've always wondered about this. The first thing that you may want to do is go into the library or academic search and see what may have been done in that area already. And then that may help prompt you into thinking what you want to do. You may think of something and it may be something that's already been done, or you maybe want to refine something, but don't worry about that. It looks like, Yolanda, you got off of mute. Did you want to throw something by us?
That might be Gracelyn. Gracelyn James, is that you?
No. Well, students, again, if you'd like to schedule a one-to-one appointment with any of us, shs@ncu.edu, we're going to have another session where we'll allow you the time to kind of throw around your topics, and we'll try to narrow them. If that is a little overwhelming to you and you want to do a one-on-one, you can. I think it's always good to have the perspective of listening to how we work through other students' projects. And so it may be helpful. You also get to connect with some of your mates, and you all can commiserate together in the Commons when you talk about where you are in terms of working on your topic. It's also a good place to get some feedback. So throw your questions out in that space as well. Again, we are more than happy to have you and to assist you to do anything that we need. So please do not hesitate to reach out to us, call upon us, email us, post in the Commons. And we want to start this process early for you, and we will just continue to offer you that opportunity. I am going to thank you all for participating. I am going to pass it over to Dr. Jones and Dr. Clegg for final words.
Well, I just thank you all for being here and allowing us to just share this process with you, and hopefully clear up some of the questions that you may have come with. And I look forward to hearing about your topics and helping you flesh it out, and look forward to being on this journey with you for the next many months that we'll be together, because we will all be in this together. So thank you for allowing us to help you change healthcare.
So, and those of you who haven't been to 7008 yet, hopefully this will give you an idea and maybe start, triggering those critical thinking juices and those ideas as you start getting into that research course, so that you can put together a solid premise that we can start to review. Again, remember, and I want to, just reiterate what Dr. Jones said, we are the School of Health Sciences family. We're here together. We're here with you throughout this entire journey. We want to see you succeed. We want to see you get out there and be great practitioners. And we want to see you proud of your degree when you leave the confines of this university. So we're all here for you. So
Confines.
Yeah. The virtual confines of this institution.
Thanks, everyone. Have a great evening. We'll make this link available so you can review it if you'd like. And don't hesitate to reach out, shs@ncu.edu.